What is going on, everybody? Josh here, Rise Above Health, back again with another live stream this evening. And tonight's subject is going to be in the celebrity health category. And we're going to be covering the Kevin Samuels Autopsy report. Before I start, please be sure to subscribe to the channel, like the video. If you're watching on Facebook, please be sure to like as well. And to go ahead and leave a comment. Give me a 1 if you can hear the audio. Just check in before we get started. Looks like we're live on Facebook. And it looks like we are live on YouTube. Okay, great. All right. So tonight's subject is going to be, like I said, Kevin Samuels, a relatively recently well-known figure. Gave out dating advice, some found to be controversial. And he passed away a couple months ago from basically hypertension. So we're going to be covering, I have a copy of the autopsy from the Fulton County Medical Examiner. And basically what I want to do here this evening is just go through that report, give a breakdown of what was going on with Mr. Samuels, and cover some of the elements of the report and see what we can learn from it, how he might have been able to prevent his untimely, passing. Rest in peace. And yeah, we'll just talk generally a little bit about heart disease and some of the medications, some of the ways you can help prevent it, etc. Important to note, though, I am not a doctor. I'm not a cardiologist. So, of course, as always, be sure to speak to and consult with a licensed medical professional before you make any changes to your lifestyle, healthcare, medications, supplements, exercise, etc. Make sure you talk to a doctor first before you do that. And with that said, let's go ahead and dig in here. I'm going to go ahead and pull up the report. And I've got some notes as well, so we're going to be looking at those. Let's see. Let me just get set up here. So I got my notes, and I'll slide back and forth between there and the autopsy report. Hope everybody's having a good evening so far. I'm going to share my screen here. All right. So here's the autopsy report. So here you can see report of medical examiner, Fulton County, Atlanta, Georgia. Here's the email for the Freedom of Public Information, request. If you want to email them, get a copy yourself. You might need to sign up for a portal, but anyway, so here's the case number. Kevin Samuels, 53 years old, black male, cause of death, hypertension, manner natural, medical examiner, name listed here. And print date 7/14. So here we have the summary of findings. Now, I think it's pretty common knowledge at this point that Kevin Samuels, of course, died from hypertension. And I think everybody kind of knows what hypertension is, but I'll just briefly go into it. And, we'll dig into some of the specifics of the report here. But essentially, hypertension is elevated blood pressure due to, constraints within the arteries and, different aspects of the vasculature. You have basically buildup of plaque, which generally leads to increases in blood pressure, also changes or cardiac remodeling, basically, which is just fancy talk for changes to the heart in terms of size and ability to pump blood around the body. So I actually have in my notes an image here just to demonstrate. So as I mentioned, right, as the report mentions right there, it says two things. Firstly, moderate aortic atherosclerosis. Now, the aorta is basically this giant artery that comes right out of the heart, and it's the main artery that delivers the blood down on through to the other parts of the vasculature. So it connects right into the top of your heart. The blood gets pumped up out of the heart. Let's get in here. Gets pumped up out of the heart into the aorta, and then you can kind of follow this red line on this image here down through the thoracic and abdominal into the iliac. Anyway, so the aorta is the big artery that comes through the heart. So the report says aortic atherosclerosis. So basically that means he had plaque buildup in this this major artery right here. And it said moderate, but there was plaque buildup. And then the other thing the report said was cardiac biventricular hypertrophy. So that is just fancy medical speak for there are two ventricles in the heart. You have a right ventricle, which you can see here. I'm just going to try and zoom in a little bit more. Here's the right ventricle. Let's say on the left of the heart, because you have to remember we're talking anatomically, right? So your right is your left and your left is your right. It's my personal side. So we have the right ventricle here on the left and the left ventricle on the right. So basically with hypertrophy of the ventricles, these essentially get larger because the heart is having a hard time pumping the blood out into the body. So the heart muscles will compensate, much like, let's say, if you're pumping, weights with your arms, that muscle is going to get bigger. So what happened with Mr. Samuels is, he had that atherosclerosis of the aorta, increased hypertension as a result of that. The heart tried to compensate basically by making those the muscles around the ventricle bigger, which in turn increases blood pressure some more. So you can see the heart is essentially struggling to pump out that blood, and it's getting bigger and stronger as a result. So you can see on the left here, this is a normal heart. If you look at the size of the ventricles, this is the normal size. And if you look on the right, you can see the muscle areas around the ventricles are getting bigger, and the ventricle itself is kind of getting squeezed for space. Now, just for quick clarification before I move on to the next section, the ventricles are the parts that push the blood up into I think it's the kidneys. It's been a while since I covered this stuff, guys. Forgive me. It pushes it up out into the kidneys, and then the other side, I think it's the other ventricle pushes it up into the aorta. Like I said, it's been a while since I covered this stuff. So, so essentially, when you have that atherosclerosis, your body's having a hard time pumping the blood efficiently. Those ventricles may or may not get bigger to compensate, and then you have that issue right there. So those are the first two things that the report says. So I'm just going to bring that back over here. So cardiac biventricular hypertrophy says the left size was a thickness of 1.5 centimeters, and the right side was a thickness of 0.5 centimeters. So additional thickness. And those are the things that were most remarkable. The report also does say he had a intracranial meningioma, hard to say, benign. So it's basically like a benign tumor, meaning basically a harmless tumor on his head. So I wouldn't say unremarkable, but obviously not a malignant tumor, right? So important to keep in mind there. Okay, so that was the beginning of the report. We covered the heart section. So now I'm going to slide along to the next part, which is the toxicology and the lab results. We're going to go over that as well. Because there were some rumors out there saying that he, might have been caused by something else. But you can see here in the toxicology reports, I zoom in a little ways here. It says hospital blood reported as positive qualitatively without confirmation, but amiodarone, which is one type of heart drug, and then you have atenolol, which is another type of heart drug, and then obviously caffeine. I'd seen several of his videos, and it was apparent, obviously, the guy drank a lot of Red Bull, so that's no big surprise there. Now, the atenolol is a beta blocker. What a beta blocker does essentially is beta blockers they bind and block the beta receptors in various parts of the body. In the case of the heart, it actually works to slow down and drop the blood pressure. And then amiodarone is actually I'm trying to remember what kind of drug it was. It's an anti-arrhythmatic. So basically, what that means is it helps to prevent abnormal heartbeats, abnormal rhythms, essentially. So at the time of his passing, he was taking 2 heart medications, one being the beta blocker. I'm sure a lot of people have heard of those. People can take them for performance anxiety, let's say, helps kill some of that adrenergic signaling. And then in the case of the heart, atenolol is I believe a heart-specific beta-1 antagonist. So that basically means it is selective to the heart, and it's going to block those beta-1 receptors, basically relax the heart and lower that blood pressure. But I guess the amiodarone, he must have been taking that, obviously prescription by a doctor. I don't know exactly why that was. He must have had some sort of abnormal rhythm. I don't know exactly what that might have been. Obviously, there's no medical records here. So we can only assume that whoever prescribed him that saw something on an EKG that gave him pause. So there's those 2 things. And then the next thing was the blood testing. Actually, no, I'm still on this one. So the blood testing, generally, so laboratory results per Grady Memorial Hospital, generally pretty normal. Urea nitrogen, creatinine levels normal, glucose within normal limits. But the one finding that was abnormal in the lab results was the hemoglobin A1C level 6.1. And actually, that is indicative of pre-diabetes. So important to remember and recognize there. So essentially what you have there is, obviously, you have the documented hypertension and the aortic atherosclerosis, and then in combination with the elevated hemoglobin A1C of 6.1. Typically, the hemoglobin A1C, it's a blood test basically to track the, let's say, long-term lingering of blood glucose in your body. So that means basically if your body is, let's say, not so efficient with dealing with the calories that you take in, particularly if you eat lots of carbs and sugar, over a long period of time, your hemoglobin A1C goes up. And if you have, let's say, poor genetics in that regard, if your family is prone to or has a history of diabetes, that A1C is going to go, let's say, up or down or what have you. So I should say up. So in the case of Mr. Samuels, you can see obviously here letter C, he has an elevated A1C indicating a pre-diabetic state. So, you have basically some aspects of what you might consider to be metabolic syndromes. Those are just classes of classes of diseases that heart disease, diabetes, etc. Right? So that's another finding, and I don't think obviously that was talked about very much in the press, but he was actually pre-diabetic as well. And heart disease and diabetes tend to go hand in hand. You might know diabetic who has a heart problem. People who have heart problems might end up with diabetes, not specifically due to the heart problems, but due to the, let's say, interrelated nature of those 2 diseases. A lot of people who have one may or may not have the other. So, in the final analysis in the report, obviously you can see the cause of death, hypertension, considered to be natural. And let's see, the coroner's office, they said, it is my opinion, Kevin Samuels died to hypertension or high blood pressure. Evidence of hypertension includes a heart whose chambers are thicker than normal. That's that ventricular hypertrophy I was talking about. So, the muscles around those ventricles were larger than normal. As it says, amiodarone, like I said, is used to treat cardiac dysrhythmias, and atenolol is used to treat hypertension. So basically, they conclude by saying, he died of natural causes. Now, obviously, you're not going to be able to let's say, prevent natural causes from happening. There's a variety of factors that can go into these type of things, namely like lifestyle, diet, genetics, medications, all of these types of things, right? But, there were just a few things that I wanted to go into on this. Now, that my primary interest in covering this, and I am going to be doing, let's say, a celebrity health section on the platform kind of moving forward. I'm going to be covering celebrity health stories to not only garner more attention for my platform and what I'm doing here, but also to let's say, use those examples in order to better educate people about what they can do to improve their health, their longevity, their energy levels, raise awareness. And of course, I have a particular emphasis on entrepreneurship and high performance lifestyle. So obviously everything we can do to get people away from, let's say, obviously Kevin Samuels was a high performance individual, worked long hours, obviously. Dealt with stressful calls and environments. So helping entrepreneurs and anyone else who wants to watch learn a bit about these scenarios and how they can better their own health. And of course, not all of these videos are going to be a death, but this is recent and in the news. So I'm going to cover that, of course. So the next thing I wanted to talk about was, now that we've covered how Kevin Samuels died, the toxicology reports, the lab reports, at least what was available from this autopsy. I wanted to just talk about a few things that you can do if you're concerned that you may have heart disease, and or if you have a family history of it, or if you just want to get more educated about things you can do to help protect your heart. So I want to talk about testing, and then prevention, treatment, and then in the case of Kevin Samuels, what might he have done differently to still be alive? So, at least with regards to his medication, his lifestyle, and his diet. So, let's see. Where are my notes? Here we are. So, we've covered the hypertrophy and the aortic atherosclerosis. I forgot. There's some more images here, guys. So, just for clarification, I mentioned the atherosclerosis. So, that's plaque buildup, right, due to, typically high lipids and cholesterol, bad types of cholesterol like triglycerides and LDL. So you can see on the left here, that is a normal artery. And on the right, you have, I'm going to flip back to the heart health tile here. And on the right, you have plaque buildup in that artery. So what that leads to over time, you're going to get high blood pressure when this happens, but you might not be symptomatic until you're, let's say, I think it's something like 70% blockage. But so anyway, you can see the progression, right? Normal, abnormal, the progression down underneath. Eventually, you have a rupture in the plaque, and then you get what's called a blood clot. And at any given time, when you have this, basically those blood clots can break off, maybe go to the heart. They're going to cause a heart attack. They can also go to the brain, cause a stroke. So, heart health ain't nothing to fuck with, guys. And, unfortunately, it ended up taking Mr. Samuels a little too soon. So, yeah, that's the atherosclerosis. I had a paper here. I'm not going to bother to mention that. But so basically, conditions that could raise your risk of developing that plaque buildup. Hyperlipidemia, meaning high cholesterol, hypertension, high blood pressure, hyperglycemia, high blood sugar. Like I mentioned, he was pre-diabetic, so that's an important factor there. Also, if you have immune system dysregulation and or inflammation, smoking is one of the, sorry guys, I keep forgetting to zoom in. Smoking is one possible cause of inflammation. So also a major risk factor for heart attacks and heart incidences of the heart. So, yeah. So like I said, you may start noticing symptoms once your artery is more than 70% blocked. So if you're already experiencing, let's say, chest pain or anything like that, you definitely want to get checked out. The blockage causes your blood flow to slow down, so your body's not getting enough oxygen. Early warning signs of that include like chest pain while exercising, leg cramps while walking, and then you might have TIA, transient ischemia, and it's like a stroke, but it goes away. And if you have that, then you're at major risk of getting a stroke. So that's the heart health section. Now for the drugs he was taking, I've already mentioned the drugs. blood works. Okay, so on to testing, right? So we're going to cover testing for heart disease, how to catch it early, how to prevent actually having, major heart problems down the road. So two things, right? Two or three things. Firstly, cholesterol. You need to test your cholesterol. So that would be a complete lipid profile. So what you want is your HDL, LDL, triglycerides, VLDL if you can get it. And then maybe you want to take a look at your LDL particle sizes if your doctor is able to get fancy like that. So that's going to help you know how much good cholesterol you have, how much bad cholesterol you have, and it's going to help round out a large portion of the picture of how your body is metabolizing the food that you're eating, and also do you have hyperlipidemia, meaning elevated cholesterol, right? Also, you might want to look at hemoglobin A1C, like Kevin Samuels had as well. So if you have elevated, cholesterol, you're going to need to look at like statins, basically, which lower the amounts of cholesterol. And then, if you have elevated hemoglobin A1C, you might want to look at something like sulfonylurea or metformin. And then, before you start any drugs, make sure you get your kidneys checked out as well, and your liver, just to make sure you're able to process the drugs properly. Your doctor can help you with that. So, cholesterol tests, right? Hemoglobin A1C. Next thing you want to check out is an EKG or ECG. Now, I think a lot of people are going to be familiar with what an EKG is. I did not pull up an image of it. That's my bad. But let me just go to Google really quick. I'll show you guys what an EKG looks like. And I know everybody's going to find this image familiar once we get it. So this is the EKG, right? So basically, it's going to tell your doctor a lot about the state of your heart, the activity of the heart, and that's the image over here, right? It's going to tell you about the state of the heart, the activity of the heart, some of those things like if the ventricles are enlarged, all of those things. It's basically a readout of the electrical activity, and that's affected by, let's say, your heart health. So this is something you can get definitely like once a year at a minimum with a physical, and then like twice a year if you're particularly concerned. Just something to be aware of. And then ECG is, right, it's another term for EKG. I told you guys I wasn't a heart health expert. So, and then there's also MRI and fMRI. MRI is basically you get in a giant magnet, and they're able to basically further assess by looking visually at the conditions of the heart, right? So everything else is usually enough, though. You should be able to be diagnosed with heart disease just based on your cholesterol levels and the EKG. So I do have a link for nerds and regarding the genetics of cardiovascular disease, if you guys want to check that out. But those are the things you want as far as testing. So again, cholesterol, EKG, maybe MRI. Yeah, you don't really need it, but if your doctor's really good, he or she or they might want to take a look at that. So next, prevention, right? So how do you actually prevent getting heart disease in the first place? Not necessarily just treating it or managing it or dealing with it. How do you try and help prevent it, right? So a couple of things, some dietary things, some lifestyle things mostly. And then, just some testing, right? If you have a family history. So what you want is a heart healthy diet of varied sources, including lots of veggies and fibers. Okay. You want a low to moderate intake of saturated fat. So, if you have problems with your cholesterol, cut out some of the pork, or, cut out the pork. I love pork personally, but cut out the pork, cut out the really fatty red meats. You want to go as lean as possible on your meats. So like 90% lean chicken and all of that stuff. Focus more on monounsaturated fats for your fat sources. So things like avocados, those are really great. for increasing that HDL, which is that good cholesterol, right? You want to avoid sugary foods and simple carbs, things like breakfast cereals with lots of sugar, for example. You can find, let's say, more complex carbs. Oats are a good, steel cut oats are a good version of that. Definitely no Pop-Tarts, guys. I don't believe I have to say that, but maybe I do. And then, like, for your carbohydrates with your lunches, you want to look at things like beans, legumes, whole wheats, brown rices over like white rice and white breads, right? Definitely avoid smoking. That's an absolute must. Exercise regularly, if your doctor says they're cool with it. And in terms of like regular testing, everybody should be getting at least a once a year physical. I think that's nowhere near enough for ensuring you have optimal health. But, check once or twice a year on your cholesterol levels and, an EKG minimum once a year if you have a family history at minimum, right? I think maybe even twice a year. I like to be cautious. That's just me. So, so that's prevention, right? Next, treatment. So let's say you now have heart disease, or, you're like pre-hypertension or stage 1 hypertension, stage 2, etc. So making the dietary adjustments I just mentioned, along with moderate exercise, you have to stop smoking immediately. Actually precipitates a huge significant drop in the immediate cardiac risk. And then focus on lowering LDL and triglycerides with dietary changes. Next, for treatments, you got to look at different cardiac medicines. So things like beta blockers. That's one of the drugs that Kevin Samuels was taking. And then there are other drug classes like angiotensin receptor blockers. Don't be intimidated by the names, guys. They're just names. So we call those ARBs. There's ACE inhibitors, and there's calcium channel blockers. There's a few others. So as far as Kevin's stage of heart disease, the beta blocker he was on, atenolol, I don't know what dose he was on, but it was clearly the drug by itself and possibly the dose, both were not enough, as his blood pressure had been elevated for far too long, and he had that ventricular hypertrophy already set in. So I don't know that that's reversible once it happens, but it would have been good for him to have been working ahead of time or much earlier with a dietitian and working to reduce as much stress as possible. He wasn't overweight, which is definitely noteworthy. Most people associate heart attacks with, heart failure with, let's say, obesity, but not necessarily the case. I think he probably had some significant genetic factors because obviously he was very thin. But those genetics can be a bitch sometimes. So I'm not sure exactly how much caffeine and Red Bull he was drinking. I know a lot of people think that that's what did him in. That may have played a small factor. And I did a quick, and I mean very quick, search, seemed to show that caffeine tends to not have too much of an impact on cardiovascular disease. There was a fairly large cohort study I found. I won't bore you guys with the details, but I will leave a link in the video description as well. But if you're staying up a lot late night arguing, and that tends to lead to a lack of sleep, and that'll definitely increase blood pressure, as will arguing. So caffeine late at night is going to lead to less sleep, and it will raise your blood pressure. Lastly, I wanted to just briefly discuss how things might have turned out differently. So obviously, getting with a dietitian, staying on top of the stuff earlier. He seemed a fairly health conscious guy. It was definitely at the very least image conscious, and that involves staying in shape. But working with a doctor on his risk, due to his risk factors, assuming those genetics, I would venture a guess he had a family history of heart disease. But as far as the drugs he was on, I think he probably would have needed an additional drug class, something like telmisartan, which is an ARB, one of those drugs I was talking about, to help further lower blood pressure, and then possibly a statin as well to help control his lipid profile, his cholesterol, ideally both earlier on. I've got a paper here with an analysis of 18 studies showing that combination is effective in lowering blood pressure. So again, I will drop that in the video description. Also, fasting. Not a lot of people know this. Fasting, intermittent fasting, regular fasting, those can help to a degree with, let's say, elevated blood glucose, bad cholesterol profiles, dyslipidemia, like elevated LDL, things like that. To a degree, it can help with helping to restore some of those arteries and clearing out some of the plaque, maybe a small bit. And then, reducing that hemoglobin A1C, all of those things. And that would have definitely helped in with the plaque buildup with his aorta to, some small percentage. So those things would have helped. That might have helped things turn out a bit differently for Kevin Samuels. But, it's obviously hindsight is 2020. If you or somebody has a family history of heart disease, and or it's something you're ignoring, obviously this is definitely a warning sign. No matter what shape or size you are, obviously, health is both a daily outside job and an inside job. So make sure you're involved in talking to your doctor and staying on top of your labs and, everything, guys. Like, can't overstate. You got to get involved if you're going to maintain your health over a lifetime. Obviously, you can kind of wing it, but the more information you have, the less you're leaving to chance, right? So definitely visit a doctor, get those lipid panels done, and ask, as a part of your physical, for an EKG. EKGs are very cheap, super cheap. You can even go to an emergency clinic, a walk-in clinic, and get those done. Just say you have a bit of chest pain. I've done it for, let's say, research purposes. I'll just go into the walk-in, the emergency walk-in, not at a hospital, sorry, but like an emergency clinic, right? I'll just walk in and say, hey, I'm having chest pains. Could you guys just check it out? They'll immediately run an EKG. With insurance, it's really, really cheap. And I think out of cash, it's not out of pocket, it's not too bad either. So very cheap and can help indicate major issues ahead of time. Lastly, good cardiologists will be able to recommend preventative measures as well as assess and make different recommendations if you're in a hypertensive state or have a poor cholesterol profile. With that said, if anybody has any comments, feel free to drop those below the video. I will get back to you. If I don't know the answer to something, I'll be sure to do my research and then get back to you. But definitely important to cover these, let's say, major health stories. Make sure people understand that, all of us are human. None of us are infallible, and, this shit can happen to anybody. So that's the deal with Kevin Samuels' autopsy. Rest in peace to that man. And, definitely, guys, check out the channel. Check out my Instagram, Facebook. It's all Rise Above Health. Make sure you subscribe. I'm going to have a lot more celebrity health videos coming up. Not necessarily, like I said, about autopsies and things like that, but, kind of pop culture-y stuff. So-and-so says they have anxiety. What the hell's going on with Justin Bieber's face, et cetera, et cetera. So, give us a like, a subscribe. I appreciate you guys for checking in. IG is Rise Above Health. Facebook group, Rise Above Health. And TikTok, Rise Above Health. All right, guys. Again, thanks so much for joining, and we are gone.